Hey folks, welcome to another live stream for Corona Care brought to you by healcircles.org. I'm your host, Rena Jadov, and today's guest is Dr. Valencia Ray. Hi, Dr. Valencia, welcome.
Hi, thank you.
We are so excited to have you today because one of the biggest emotions that binds us all during this crisis is that emotion of anxiety, fear, and I love that you're drinking tea. It's calming me down just watching you. Oh, Valencia, I think we've all right, we have you back. So tell us a little bit about your background, Valencia.
Okay, so I'm a medical doctor, and before coming to functional medicine, I practiced ophthalmology for many years. In Chicago, I had a medical practice, and then after transitioning and moving to Northern California, getting settled, retraining in functional medicine, et cetera, I started a practice in Walnut Creek, California. So now I'm solely focused on helping busy women to overcome burnout and to stop those annoying health symptoms without the scary drugs and experience greater vitality, connection, and confidence. And I'm really excited about what I've seen since I've transitioned in functional medicine, how very different and more effective it is than the general traditional medicine I was practicing for decades.
Absolutely, and I'd love to get your thoughts today on how does functional medicine approach thriving through Corona, right? So there's obviously the conventional approach, and we're all hearing about all the different medications. From a functional medicine standpoint, someone who's concerned about having a precondition, for example, maybe they have high blood pressure, maybe they have diabetes, what is it that we can do to get stronger? Because what they're saying is we're all going to get the virus at some point.
Mm-hmm. Right. Well, like any virus, many times in seasons past even, we could have had a positive virus test result and never knew we had it. So just because for example, I haven't had a cold or flu in a couple of years now, that doesn't mean I wasn't exposed or didn't have a positive test to it. It just wasn't tested. So the key is not to get overly concerned about every season something new. The key is getting our immune systems really strong. And that's what functional medicine shines at, is preventing and reversing chronic disease and giving you natural, holistic, science-based approaches to help you in terms of your body's nutrition, your metabolism, reducing inflammation. So for example, it's interesting, the Plaquenil that they've been talking about using, that you hear, the hydroquinone, as an ophthalmologist, when my patients were taking that for, let's say, autoimmune rheumatoid arthritis, they had to come and see me every 6 months to have their pupils dilated to look at their macula, because there's a potential risk to the vision with that product or with that drug over time. And also there's the issue of they would have to have the visual field test done. I will say that in an acute situation, I don't have any experience with using it in a life and death situation, but chronically it's a very toxic, potentially side effect drug. Whereas in functional medicine, there are things you can do to reduce the inflammation risk. I do nutrigenomics, which is changing gene expression using food and supplements and lifestyle. And we have a whole panel that we study on these types of cytokines that you're hearing about to know who's at risk or not. And you can actually do something about it, even at that root cause level, to prevent future problems with detoxing and inflammation. So long story short, the key is, what I would like to do is share some functional medicine tips, like literally what I'm doing.
Perfect.
And that would help us to prevent potentially, of course, we don't have data on any of this because there's not a lot of research being done, but we've known over time vitamin C helps with viruses, for example, and apparently it's no exception with COVID. So if you can do certain natural things to prevent, and then if you get into trouble, be aware of certain things. But what we all notice here, and this has been true since I graduated medical school over 30 years ago, that chronic illness, chronic disease weakens the immune system to the degree that every cold and flu season, okay, tens of thousands of people actually die. And this one is getting a lot more attention, of course. So how do we prevent going forward? I would suggest learning about functional medicine principles so that you can either reverse your pre-diabetes or your obesity, chronic weight gain, or prevent it from occurring in the first place, because the pill for an ill model does not help with chronic disease or reversal or prevention. And so we're going to have to take greater responsibility for our health going forward if we don't want to be a potential future statistic in the cold and flu season arena, which has been going on for decades now. So I'm going to share, I wrote my tips down because I don't want to skip anything, and I know we don't have a lot of time.
Fantastic. Tell us what you're doing.
Okay, so what I'm doing, adequate sleep. Since I focused and started studying stress specifically as the umbrella. And why did I do that? Because literally stress causes 95% of chronic disease. People don't realize stress is at the root cause of this epidemic of chronic disease in many ways in the first place. And I'll say more about that. The key is sleep, 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 as much as your body needs. Usually that's 7 to 8 hours. I learned this the hard way myself. And if you feel tired, just let your body rest and restore. Now, lack of sleep actually feeds right into the next one as well, which is, I'm going to talk about avoiding stress a little bit here later, but psychological stress is certainly, everybody knows about that one, because that's what you mentioned in the beginning, anxiety and worry about the virus. But what people don't realize is that that same stress mechanism in your body that affects your adrenal gland, that causes inflammation and other chronic disease, starting that process, is too much sugar. So while you're at home, be careful with that. Learn to change your diet to stop eating so much sugar. It's a major inflammation producer. And when we don't get enough healthy fats, and we are craving high, carbs all the time, or certain foods that we may think are healthy, but they're high in carbs and potentially inflammation, all of that feeds into this problem. Then there's inflammation itself, that toxins are everywhere in our environment. So functional medicine is really good about helping you to find those toxins in your body and to take natural supplements and foods to detox yourself and help your liver. Things like going to boot camps when you are already weakened in your immune and stress response. Boot camps can actually add to the problem of inflammation. And then that whole burnout, I'm tired, I'm fatigued, I'm not getting enough sleep, all of that contributes to inflammation. And then the last area ties back again into sleep, which is circadian rhythm. So if we're going to bed all hours of different days, different times, if we are on our devices too much at nighttime without any blue blockers, if we are getting off the computer and then falling into bed, that disrupts your sleep cycles. All of those things can work to lower melatonin in the brain. And melatonin is actually important for reducing oxidative stress, lung inflammation, brain inflammation. And you'd be surprised what a large percentage of people I see who have low melatonin and disrupted stress cycles. It's actually
Absolutely
majority, yes.
Mm-hmm. How much melatonin do you recommend? Because I find if I go more than a couple of drops, which is a very small percentage of the recommended dosage, I get interesting dreams and nightmares. And
a lot of people will do that. If you get regular sleep, you don't need your body makes it. The people who are low are the ones who are not sleeping right in general, or poor circadian rhythm with the sun and the sleep and the light and the dark. So like in the evening, I have the light on in here because I want light for the Zoom. And as it gets toward dusk, we stop using the in the ceiling bright lights, and we use the island lights, which are dimmer. And that's true around our house because bright light will actually drop your melatonin. So at nighttime, after, let's say, dark for sure, lower your lights, put your blue blockers on if you're on the computer still or watching television, because those things will drop your melatonin. So the normal dosage usually is only 1 to 3 milligrams. And I only recommend it as a supplement in general when I know a person has low melatonin, or I know they have poor sleep habits, to get them started until we check it, etc. But it's not something I would just randomly recommend to the population. Then another important supplement, very important, is zinc. And that's usually like 15 to 30 milligrams. I have a brand that I'm using, Pure Encapsulation, which is like, well, it's zinc 30. It's zinc penkenolate, and it is 30 milligrams. I am using that in addition. I don't use it routinely. You can overtake zinc. However, I do periodically check my nutritional levels, and sometimes eating too much hummus can actually raise copper levels, and that can actually lower your zinc level. So be aware of that. And so you don't want to be too high in copper for sure. All right. Then veggies. So here's the thing about veggies. You want to eat fruits, and you hear about fruits and vegetables because they contain flavonoids, which can be helpful for inflammation and helping to balance your system. But please avoid sugary fruits. I mean, it's one thing to have a treat of a banana or a treat of a mango. You really want to stick to the low glycemic fruit, because this goes back to one of those 4 stressors I was just talking about with sugar. People are under the misconception that fructose is safe. High fructose, including high fructose corn syrup, which you want to read your labels because it's in a lot of cold and flu medications. High fructose corn syrup is a major league producer of potential inflammation, especially if you have genetic risks for that. Well, too much sugar, whether it's fruit or not, is a major contributor to non-alcoholic fatty liver disease. And you do not want your liver to start dysfunctioning in this toxic world we're in, because then your inflammation can really, jack up. So be aware of that. There are some supplements such as Chinese skullcap, quercetin. You may have heard of that. You can find it in onions and apples. It can help a lot with congestion and sinus symptoms when you're getting congestion. I already mentioned like the berries, celery and parsley. I have it right in my fridge. Parsley is good with your kidneys, and the celery is good, diuretic as well. I put almond butter and eat my celery. And everyone, I used to despise celery. So I just want to encourage you that as you change your eating habits, it becomes natural. We're creatures of habit. We just have to go through that little window period to change how we think about our body, our health, our food. And then it just becomes a lifestyle. You don't have to diet. You don't have to, worry about these kinds of things. Honestly, I'm not particularly worried about COVID personally, because I know I have a strong immune system, and, we'll see what happens, but I'm not going to worry about it. And then in terms of the other thing I just want to mention, your important green vegetables, leafy green vegetables, asparagus. And asparagus is really good for glutathione, which is one of my go-to supplements I want to recommend for sure. I take liposomal glutathione every day anyway. In addition, to NAC, you may have heard that, so you can put that on your health.
Valencia, I actually have a question for you on glutathione. I've heard that oral glutathione is not absorbed very well, that it really should be taken intramuscular. What are your thoughts on that?
That's true for general glutathione. It has to be liposomal glutathione. Liposomal glutathione is a special preparation that is formulated so that the molecules are a different size and they get absorbed. Unlike, to your point, you're correct, regular glutathione breaks down quickly in the stomach, so don't even waste your money buying regular glutathione. You need the liposomal form.
Yeah, because it's quite expensive, and I know that there's a lot of misleading products out there
There are
Yeah.
lots, especially over the counter. I know it works for a fact because number one, I have a gene SNP where I need to have extra glutathione.
Me too. I think
Yeah,
it's a methylation issue, right?
yeah, it's a methylation issue, and it's also I have a gene that is makes me more susceptible to mercury and smoke in the air and that sort of thing. And so
How do you
I
get tested for that gene? Because you know, I have a feeling a lot of people have it. And if we could all get tested and know that, we could take better care of ourselves. So what test did you do to figure that out?
I have a panel that I do of about 300 genes. I've been studying this now for a little while, and I help people. I actually do. You can do it as a standalone service if you like, but it's a gene called. It's a panel called Intellex DNA, and on that test, it even provides the cytokine storm genetics, potential. And I found out the hard way when I first moved to Chicago, just before I was starting my from Chicago to here, just before I was starting my as I was in the middle of my functional medicine training, we had that last big fire in Paradise. And I was so bold I didn't know about fires. I'm from Chicago. I was out there in the fog and the smoke and about within a few days, I got sicker than I've been in years, and I just saw like, wow, that was really weird. And I happened to take a Dutch test in the middle of all of this, and my oxidative stress was high, like high in the high range, and I didn't understand yet. Even though I've been a doctor for over 30 years, I didn't understand what that meant at first because it was one of the very first tests I had done in functional medicine was on myself. At that point, oxidative stress will damage your DNA. Damage your DNA. You heard that
Oh
correct?
my God, it's
And
one of the.
I heard that. I
Mhm.
jumped on. I knew what to do because I was just learning about it. I started that liposomal glutathione, retested myself. It was back down. Okay.
So
And
interesting. You were able to do a before and after, because that's one of the other things that most people are uncomfortable investing in because they're not necessarily sure that there's intrinsic improvement. But you're saying you've actually done the before and after.
I've done the before and after. I do because that's the advantage of being a medical doctor. I suppose when you retrain in functional medicine, I have to say, is that I have that whole medical background. All that I treat in functional medicine, I used to actually work with as an ophthalmologist, and we deal with chronic disease all the time because of all of the eye problems that go along with chronic disease and autoimmunity. So it's really important to have science-based data for me, and I know what to do in that part. And then certainly in functional medicine, I've learned. So I do follow up testing, especially for the more serious things that you want to make sure. I did I'm going to start doing it once a year, especially now that I know I'm sensitive to mercury. So I did do a repeat mercury test randomly in December. And lo and behold, I was running a little high last year, but not high, but still in the safe zone, but on the a higher end a little bit. And the only thing I really did differently was start eating a lot of plant-based protein powder. That's the only thing I did differently. Mercury is higher in those kinds of products than, let's say, whey. And I do have a whole house filter, so I know I'm filtering mercury out of my water. My mercury was so off the chart, I immediately, did everything I could to treat it. And part of treatment is lysosomal glutathione, vitamin C, these things I'm telling you about right now. I verified a repeat test in 2 months, and it is way normal now. My lead even went down.
That's
So
wonderful news.
that's really important because you can have mercury toxicity and start looking like you have Parkinson's, and it will
Very
probably be
true.
diagnosed that way too, even though because it's not checked usually.
Between you and I feel a lot of the explosion that we've seen in brain-oriented diseases like Alzheimer's, dementia, etc.,
Yes.
even neurological, I feel a lot of it has to do with just deep toxicity.
A big part of it is I am certified in Dr. Dale Bredeson's RECODE, which is the Alzheimer's functional medicine protocol.
Oh, wow.
And they're in the process of bringing me into this structure of support that he's created. And so for sure, things like toxins, things like the brain inflammation, things like women going through menopause can drop the whole hormone balance in the body. That's why a lot of women after menopause get brain fog, and 2/3 of Alzheimer's patients are women. And it
So
has to
what is the link with menopause again?
Okay, so after menopause, our estrogen plummets. That's Men don't go through that.
And how is that connected to,
Alzheimer's?
yeah, connect the
Yeah,
dots for us.
estrogen is connected to memory, even in men. And so Dale Bredesen's work, Dale Bredesen was a Alzheimer's researcher, MD, PhD, University, I mean,
Oh, he's
UCLA.
amazing. He's a
Exactly,
god in this. Absolutely.
exactly. Well, part of his protocol is to normalize women's hormones because he saw that that is a correlation for sure. And so that part of the protocol is that you want to make sure your thyroid hormones are right, keeping the stress in balance. You want to make sure that your sugar, you've heard the term that prediabetes was Alzheimer's. Alzheimer's 3 was prediabetes. You've heard that, right? Or let me take that back.
Yes.
Diabetes, type 3 diabetes
Yes.
is like Alzheimer's.
Exactly.
Right? Well,
Exactly.
it's really type 2 diabetes as we know it, but there's this association with Alzheimer's with prediabetes and diabetes. You see?
And
So,
it's all related to a hormonal imbalance in women specifically.
well, it's also related to the hormone balance, and specifically separate and apart from prediabetes. Prediabetes is one of the categories of potential causes of Alzheimer's that we look at. Toxins are another category for sure. So if you are a woman and you're going through menopause, or you're in menopause, and you have obesity, which is a risk factor for inflammation, and you have prediabetes, can you see where this is going?
It's the
Okay,
perfect
now just
storm.
getting a flu shot is not going to overcome all of that.
Mm-hmm.
And if you have a strong immune system, your natural immunity historically deals with these kinds of flus and situations. I in my medical training converted my TB test and had no idea I had even been exposed to TB. What that means is I have immunity to TB. So when you test me now, my arm will blow up. But I never even had any symptoms. My lungs have been clear for 30 years because what happened? Fortunately, my immune system was so strong, it doubled down and made antibody and knocked out the bug before it even gave me any symptoms. I never even knew.
And that right there is what we need to get ourselves ready for.
That's what we need.
That's right there, right? That's what we're trying to do. So let's tell us, for those of us that are listening, and I want to just focus for a moment on those over 40, right? Over 40, over 50. We know from the data that those who are passing away tend to be predominantly male over the age of 50 with some existing conditions. And of course, those are defined as even blood pressure, which heck, you cross 50, pretty much everyone's got a little bit of blood pressure.
Not me.
Not me either. Not me either. I am actually always so low that they always ask me, how are you standing? But my body just tends to be on the lower side. But for a lot of people, there's a lot of pre-existing conditions. So talk to us about that checklist, right? So you mentioned supplements. You talked
Okay,
about.
let me throw in just the last supplement. So there's the vitamin C, make sure you know. I've mentioned several others. And I just want to make sure, heads up about the elderberry. There's controversy about the cytokine storm happening with elderberry. Elderberry doesn't cause a storm per se. You can take it if it's preventative, but I'm not recommending it. I don't take it because you don't really know what your gene panel looks like in the first place. And if you were to get the virus or were to get into the inflammation symptoms, there has been this potential association with many of especially elderberry, but particularly the drugs that stimulate immunity, like echinacea. I take echinacea some, I'm not worried about that. But the articles and things I've read was specifically just giving a heads up about elderberry. Excuse me. Getting a scratchy throat here talking, must be talking too loud. Excuse me. And then remember your vitamin D. So you asked me about a checklist. Is excuse me, is that the emotional resiliency?
Yes, exactly.
Getting a frog in my throat.
Yes, take your time.
Okay, so before we transition, I just want to mention a couple things. Like if you do get symptoms, a virus, it could be COVID or just influenza virus, just know that, again, be careful with the over-the-counter medicines, read those labels, and some helpful things you can do to get you through those symptoms are things like adding garlic or getting supplements that have the part of garlic that which is allicin, which helps you, strengthen and calm and is anti-inflammatory. There would be quercetin. Again, that's in apples and onions as far as a food. Astragalus, peppermint, use that to clear and soothe. There is zinc, of course, green tea, and taking some vitamin A, about 25,000 IUs, can be helpful in this phase, as well as, of course, continuing your vitamin C. So if you would like, now I can just start talking about also, I think one missing link that is huge and hardly even many functional medicine practitioners aren't really addressing it is emotional resiliency. So I'll go ahead and proceed. Okay, then Rena.
Before you jump on that, there's a quick question I have on supplements, and then we'll dive right into that. Is, does taking adrenotone supplements help?
Before I prescribe supplements to people, the only universal supplement for adrenals I find in general can be ashwagandha. Even if you're low or if you're high, if you're in phase 1, 2, 3 of cortisol dysregulation or dysfunction, ashwagandha is pretty safe because it adapts up or down, and I have found it useful, even personally. But other than that, I know, and I've seen the difference in myself first, and then how I treat others. You really would like to have a cortisol curve to know where you are on that burnout cycle or not, because depending on what your curve looks like, if you're taking licorice, you could be doing more harm than good. If you are popping up at night in the evening, that's not good for your brain. That's not good for your whole body to be bathed in cortisol as you're going to bed. It can disrupt your sleep. So then you would need to make sure you're on nothing that's going to rev you up as far as your adrenal supplements. You want to be, after 4 or 5 o'clock in the evening, you want to make sure you're bringing down and coming down off of that cortisol curve. If you're having a lot of problems with burnout and low energy, that's going to change the profile of the adaptogens you use. So it's not a one size fit all, but to your point, this whole resiliency and response to inflammation is linked to the functionality of your adrenal system. So you do want to know it's such an important system that affects hormones and brain and sugar levels, diabetes. Oh my goodness, it's so important.
How does licorice impact the adrenals?
So licorice is actually can raise up the cortisol levels. So you want to get, in general, many people, you can use DGL, which is the licorice is deglyceride or whatever.
Yeah, deglycerized, yes,
Right.
DGL.
That will be more of a mucus coating for like leaky gut healing protocol, but it has that taken out. But years ago, because I love to focus on this, for one thing, was part of my journey. I have a potential TED talk on it. I mean, it was really, you can imagine the busy ophthalmologist gunning ho, get out of medical school early, or, just couldn't stop. Not only do I have a gene risk for managing stress, but I used to drink licorice tea. For me, at that time, oh no, I didn't need any extra push, but I didn't know better. So it's usually used more like in the case of, let's say, people who have adrenal fatigue, or, well, we don't use that term fatigue per se, just means that when I say fatigue, they have fatigue and their adrenals are running out of gas in terms of ability to produce cortisol, and it may need nutrition and
Which is
healing.
a lot of us, which is a lot of us.
Yeah, that's the problem. That's why as the people who will change their habits and learn about functional medicine are going, it's like survival of the fittest, so to speak. If you stay in a system that is only masking your symptoms, like people think taking cold and flu medicine helps with the virus. It's not helping you with the virus. It's helping you with your symptoms. And if you're not careful to read the label, you're exposing yourself to things that increase inflammation, like artificial colors and high fructose corn syrup. I haven't taken an over-the-counter medication in so many years before I even knew about functional medicine, because I learned a long time ago that high fructose corn syrup was dangerous. And I one time was going to take this certain product that is very famous, and I read the label and I thought, OMG. So no.
All right, let's move on to stress, anxiety, and what do people do to keep resilience?
Okay, so this is one of my, like, this time and place is finally like the perfect context for me to bring this message that I had a hard time finding my voice in, because I just did. It was part of my own spiritual journey, but it's emotional resiliency. And I used to be afraid of my feelings like everybody else. I didn't want to talk about my feelings. I didn't want to deal with my feelings. I didn't want to feel my feelings. I was terrified of my feelings a few decades ago. But I learned gradually after hitting the valley in my stress journey, that that's very not good for you. And it also disempowers you. So I've been through this long journey, and all the pieces come together to the point where, in all humility and with great gratitude, I can say I have quite a bit of emotional resiliency. And while part of that is to have compassion for those who are in fear, even if I'm concerned, even if things happen in my life that are trying, I don't get that emotional rumination. I used to ruminate so much I couldn't sleep. And there's a skill set, and I call it emotional resiliency a superpower that most of us have no clue on how to access, because at very early ages in our life, first grade and beyond, we are actively taught to repress our feelings. You ever heard big boys don't cry?
So true. So
right?
true.
You little crybaby. That's what I used to get. You're a crybaby. You're a crybaby. From my siblings, etc. Because I was sensitive when I was younger. And then all of a sudden I went the other way and put all that armor on, and then comes the anger, and I'm fighting all the time, or either I'm denying I feel anything. And I started getting a heart murmur in my 20s. And once I learned all these things, and anyway, the heart murmur reversed, and I don't have any more chest pain. I don't have any more heart problems, because people don't understand that you have emotional fields around your body that actually get weakened when you don't understand, when you're dealing with these emotional issues. So I just put a little outline here that I want to cover. In this time of stress around us everywhere, you have to take you out of the picture of that field. Nobody can do it for you. And use this to start to do some little steps to, number one, understand how dangerous it is to ignore your feelings and have no skill set to manage them, because you can get hijacked very easily by anything. And that can raise, all of this chronic disease risk and et cetera. So you want to understand that stress, anxiety, worry, all those food problems I was telling you about, too much sugar and all that, literally increases the risk of your immune system being weakened. It literally weakens your immune system. So I want to say this before I forget. Turn off the television if you are getting freaked out, worried.
Exactly.
If you to not be able to sleep well, you are killing yourself. And I'm not exaggerating, okay? Because stress is a silent killer. we don't know as a society what stress really even is. So we just think, oh, if I just kind of suppress my feelings, pretend like I'm not anxious, then I'm not really stressed. Or we don't understand that overwhelm itself is stress. Because I have asked people, do you have stress? And they're like, no, I don't have any stress. So, well, do you feel overwhelmed at all sometimes? Yeah, I feel overwhelmed all the time. Duh. Okay, we just don't know.
Yeah.
That is part of it, but then there's the food part. Now, know that the vibration of your emotions matter. And I'm not telling you that there are bad emotions and there are good emotions per se. Emotions are a spectrum, and it's part of being a mammal human, a human. If you think that you don't have emotions or you can check your emotions at the door, you're kidding yourself. It's part of being a mammal, of being a human being. And what we have to start doing is learn how to be more skillful with our emotions and be able to feel them and release them and be aware of where we put our attention, because our attention affects the type of emotion that gets stimulated in our body. That's why I said turn off the TV if it's scaring you, because you're triggering your whole nervous system to produce the molecules of emotion of fear.
I
And
would add to that, turn it off even if you don't think it's scaring you.
I think you're right. I don't
There's
watch
nothing
it.
good coming from it.
That's it. It's people talking and saying the same thing over and
Yes.
over again.
And these red pictures going, I mean, you look at visually how scary they make it, right?
Absolutely.
We don't need those images.
You absolutely don't. The brain thinks in pictures. So what you're taking in as a picture is making like an imprint on your brain. And that's why you can close your eyes and sometimes still see that picture. Well, here's the thing to be aware really importantly is that cases, when they talk about the number of cases are growing, please be aware that cases just means number of positive tests.
Exactly.
25%.
Exactly.
Right. 25% of people, last I read, it might have changed, aren't even symptomatic. And that's the case. Okay. So of course the cases are going to grow because they haven't been doing testing. What, 200,000 people? There are 330 million people in this country. So we don't have data. We really don't have good data. Millions of people are probably walking around with it. I might have it. I don't know.
Exactly. I've told multiple people, please don't look at data anymore. It doesn't mean anything. Just focus on you.
They're not presenting it the way we normally present it. Normally, when you talk about death rates, you have to have like the number of exposures in the population. That's why, there is actually an editorial article in the New England Journal of Medicine from March 26th that Dr. Anthony Fauci and 3 other doctors wrote saying that the projected death rate from what they're really seeing in terms of the factual statistics is looking more like the influenza virus with a rate of 0.1%. Now, you can go look that up. You can Google it. The New England Journal of Medicine, March 26th. Put his name in and you'll pull it up and you just read it yourself. So I don't know why there is such a disconnect, between what we're hearing on TV and these kinds of, but I'm not going down that path. I'm just saying, get healthy. And then you won't have to be part of the 99% of people who do pass away who have chronic disease. That the people who do pass, which is a small percentage relative to the whole population, they have pre-existing conditions in general, but that's always been true of even the influenza virus. So now, low energy vibes, things like 5 examples: fear, anxiety, sadness, chronic like grief, anxiousness, and anxiety and worry. You want to be able to, grieve like you need to. I'm not saying you just push these emotions aside, but I'm going to tell you how to begin to release them quicker so that they process through your body, and you can pay attention to how you are ruminating or focusing your attention, and just be more self-aware and mindful so that you can learn to shift yourself out of these states. as compared to high energy vibes. Here's the thing, same thing applies for gratitude and appreciation, humor and joy, feeling socially connected. We have to work on that when we're being socially disconnected, right? We have to be aware that there's so much research in the past 5 years that social isolation by itself is a major contributor to chronic disease. By itself. So be careful with the social disconnection piece, because that we're mammals. We're supposed to be connected. So again, high vibe means better health, more energy, more motivation, more feel-good neurochemicals in the body. Instead of increasing inflammation, they can decrease inflammation. So now, emotions, three things I want you to make sure you know is strongly influencing your susceptibility to stress when you're in those low vibe emotions I just named. It affects your hormones, your inflammation, your healing, and then when that gets out of whack, then the hormones can affect your feelings and your stress. When your hormones are flying, you're irritable, you're sad, you're crying. So it gets into this big loop that you want to balance and fix. And then the last thing, our emotions affect our libido, our relationships, our motivation, because when you're not, you're feeling grieving and sad and you're stuck there and you don't know how to move out of that, you can be stuck there a lot longer. And of course, that will even lead to depression. So we want to be aware of that. And of course, our health matters in depression and anxiety, because sometimes it's just the bad food that we're eating that is inflaming our gut that is causing the depression and anxiety. So this is a system. We're all interconnected. So in closing, here are some tips. Is, once again, turn off that TV. And again, whether you think it's scaring you or not, it's not helping you. Just knowing this data being thrown out there without context does not serve you. So do the things to stay healthy. You can practice social distancing that we're going through right now, and et cetera, et cetera. But just know you need a long-term strategy here. You can't live like this. And you can't keep gaining weight and not doing anything about it without potential down the road problems. So recognize the importance of feelings. That's the first thing. We have to start realizing how emotions are so important, and how strong the energy in the nervous system is, like the glue of the nervous system. So let me ask you real quick. How many of you remember 9/11? Just think about that. So if you're a certain age, you definitely remember it. If you were in the United States, my kids don't remember it, but I remember seeing that the planes on TV and crashing and all this. A lot of people got PTSD from that. So you know where you were. Most people know where they were at 9/11. Where were you September 11th, 2019? Can you remember, like right now?
Oh, I was, you bet. I was with my older daughter and my husband in Florida.
You were on vacation. It was emotional.
We were on vacation, and my husband wakes me up and says, "You're not going to believe this. I don't know if do you think this is a hoax? Is this like an April?"
Oh, wait, you're saying it was 2001 when you were in Florida.
Yes, the 9/11, yeah.
Right. So what I was just asking, see how you remember 9/11, 2001?
Yeah.
I said, does anyone on this call remember where they were September 11, 2019?
Oh, what happened then?
Anybody? I don't, unless it was your birthday.
No, I don't.
What's the difference? 9/11, 2001 had a lot of emotion to it. You see how this works?
Absolutely.
How powerful emotions are to memory and to your body's physiology. You can feel all the way back how you felt back then or whatever. So that's why we got to get an education and a grip on understanding our emotions, because right now, if you're not dealing with the situation consciously and you're just jacked up by all the chaos going on, you are damaging your nervous system with the inflammation and with mind, and it's not even serving a positive purpose just to be on hyper fear alert. How is that going to help you? You get the data, but if you're staying at home and you're doing the things I gave you to do with supplements, you're eating right, you're sleeping, well, that's all you need. Now, becoming more self-aware, I just mentioned that. That'll help you with your emotions too, because when you become more self-aware through meditation, mindfulness practices, you can notice your thoughts, notice your feelings, be more self-aware so that your shoulders actually, you can feel in your body, I'm cramping up in my body. I need to get up and breathe and stretch and release the tension and the stress just accumulating because I've been sitting here too long. Self-awareness is part of this process of emotional resiliency as well. Then using tools like tapping. Many of you may have heard of tapping.
No, in fact, I was surprised how few people know tapping. So
Really?
Valencia, could you just give a quick primer? What is
Oh,
tapping, and maybe just do a couple of quick taps?
yeah, absolutely. It was originally called Emotional Freedom Technique,
Right.
EFT. I
Yeah.
learned it over 20 years ago, everyone. So it's not new. But then they turned it into this, they got it out there as tapping. So it's using the meridian system in your certain parts of your body. To think of it this way, it's like a compressed file release. So instead of just drowning in your emotional release, because I don't recommend that you just dive into the deep end of the pool. Emotions are like the element of water. That's what it's compared to in like different ancient systems, emotions associated with water. Well, don't dive into the deep end of the pool. Learn how to tread and swim first. And that's learning tapping, using the EFT. And it goes like this. You're on the side of this hand, while you're feeling the feeling though, that's where it doesn't work for many people, is that they're just in their head going through the motion, but
Right, exactly.
feeling the emotion of it. So you got to think of the situation that you're worried about. Think of COVID 2019, 2019, COVID-19, how worried I am, how stressed I am. And you feel that fear. And then you're tapping. Even though I have this fear right now, I am really afraid of this virus situation, but I deeply and completely love, honor, and accept myself. But you can say something else on that part, but it's usually
You
like
know
an
what? May I request you to slow down? I want everyone to follow Dr. Valencia Ray right now and do this. All right, let's do it. Let's actually do it. Just a couple of minutes.
okay, sure.
Please go.
So you can repeat to yourself. Your mics are not on anyway, so you can say it out loud just with me. So even though I feel terribly afraid of this COVID-19, I deeply and completely love, honor, and accept myself. On the side of your hand like that. Even though I just don't know what to do, I'm worried and anxious, I deeply and completely love, honor, and accept myself. Even though they put these scary stats up there and I don't know what to believe, I don't know what's going on, it just worries me, I deeply and completely love, honor, and accept myself. So you tell the truth. You're not kind of fake it till you make it stuff with this. And then you tap here in the corner. This fear, then you go to the corner of the lateral orbital rim of the bone. This worry, then the lower orbital rim of your bone. This anxiety, type here, halfway between your nose and your upper lip. This worry and anxiety. I can't sleep at night. It's bothering me. I'm afraid. You're tapping right here in the corner of your collarbone, right in front of the notch where this collarbone meets. There's a corner here that kind of is an indentation. You tap there. I usually just do both sides instead of just one side. Some people just do one side of either side of your body. I just go down symmetrically. And then where your bra strap is, about 4 inches or so under the armpit, you tap there. And while you're still saying the feelings that you're feeling, this anxiety, and then you tap at the top of the crown, the top of the head. Some people know it as the 7th chakra area. You tap there. And one thing that I do that's different too is that after doing a few rounds of that, the emotions will start to like get out of the body faster. And I always smooth it out with something positive, like the last go round, I'll say, but I'm feeling better. I'm learning how to work with my feelings. I'm learning how to use this EFT or this tapping to help me to manage my emotional resiliency. I'm becoming more emotional resilient. I'm making friends with my feelings. I'm not afraid of them anymore. I'm learning how to not be afraid of them. You go like one, at least one round all the way through with the positive. I am grateful for what I am learning, etc. Because you want to smooth things out when you're finished with your session and not leave the session kind of discombobulated. Now, I don't have emotional problems like I used to. I used to struggle badly with them. And during those years that I was using EFT and learning all the things I know now, I just would wake up in the morning with a pit of melancholy in my stomach. I don't struggle with any of that anymore. And it has a combination to do with these kinds of tools. It has a combination to do with learning, like I know I have certain gene SNPs that can certainly get out of balance if I'm not sleeping right or stressed, too stressed, etc., and not taking supplements, which can cause kind of this kind of busy behavior. And it just, certain people, I don't have that gene, but there are genes that literally increase your depression. So, and then gut issues and all that. So just know that it's a system approach. And just doing this alone helped me tremendously before I even got to functional medicine. I've improved over time, years before even coming to functional medicine. So I definitely recommend it. Then another tool is something called cognitive behavior therapy or cognitive behavior coaching. And this one I really want you to know too, because it has to do with like why I say turn off the TV. Because wherever you put your attention, your energy expands, your focus expands. And it goes that, thoughts are coming from where you're telling your body, where you're telling your brain, I want my attention on that. And so your brain is like, okay, I can expand your awareness of that. Well, CBT therapy, cognitive behavior therapy, helps you to learn how to be self-aware, and mindfulness meditation plays into this. I'll say something about that in a minute. But once you become aware of where you're putting your thoughts, you can actually shift consciously off of the thought toward an affirmation or toward the kind of feeling or direction you want your emotional body to flow, because your emotions follow your thoughts. Your thoughts are things, emotions are, energies in motion. And as you put your attention on the TV, you're actually prone to stimulate fear thoughts, depending on what the meaning of the TV means to you. And for most people right now, the meaning of COVID is not warm and fuzzy, right? So you don't want to put your attention there because you're going to get that list of negative feelings. Go put your attention on something beautiful, lovely, something that inspires you, that makes you feel good, that gives you peace. So spirituality, as far as I'm concerned, it saved my life when I was, way back there, and all that, all that stress and struggle and not knowing how to deal with my mind and trying to, be strong on the outside. And so whatever that means for you, but the whole point is it gives you a sense of, you have to learn how to be grounded, manage your energy, feel connected to more of life, not disconnected. If we get disconnected, not just from each other, but from nature, we are so setting ourselves up for worse things to come. So just want to mention that. And then the self-love and self-acceptance, especially women. How does this tie into stress? Here, I'll tell you exactly how. In my journey, I learned that there are actual research out there, there's studies out there, that low self-esteem causes stress. What? You might say, how does that work?
Yeah, what?
I can tell you from personal experience how it works. Even though I was very accomplished on the outside, I had a journey of learning how to not be a perfectionist, not to beat myself up. Because as a young person in my particular family system, or et cetera, and then in women in the war, women have to worry about things out in the media all the time. They're always trying to make you feel like you're less than and not enough. Go get your surgery, go get, fix this, fix that. Okay, it's a big sales pitch. And if you don't really feel good about yourself, like nobody looks perfect, and a lot of the perfect pictures you see are people, their best and made up. And what beauty really is a self-definition. But the bottom line about that is we think that humility is about self-deprecation, and that somehow if you feel good about yourself, or you think I'm okay, or I admit that I have confidence, or admit that I'm good enough, oh, somehow you're arrogant. No, no. Okay. Narcissism is really about thinking about yourself in a way that you're always insecure. Narcissists tend to not be able to connect with people, or they tend to be overly obsessed with their own security because they are so insecure. I think there's a world leader, you might know who I'm talking about, that tend to be
I have no
very
idea who you're
narcissistic,
talking about.
right? Okay, that's coming from insecurity. Not I'm, but the front is often bravado. So when we love and accept ourselves, and we're not hearing that rumination, what did I say about thoughts and how thoughts cause our emotions to not feel good? Well, I used to go into a setting of people at one time in my life. It was like this. And I'm worried about, is they're running my stocking? I'm worried about, what am I going to say to the person? I'm in my head being narcissistic, worried about me, instead of just being relaxed. I'm okay and I'm on my way. And I'm going to go be curious and find out about this person. How can I learn about this person? Or how can I serve this person? I had the guard up. And that's what insecurity and self-esteem issues can do. That anxiety is literally stimulating your stress response. And I have read studies where they have done the actual little, in the world of psychology. There's studies out there, you can even verify it. But I knew personally that has to happen, because if I'm feeling nervous, I'm feeling stressed. Okay, so learn how to stop beating yourself up and be okay, and stop, change your definition of what humility means. It's really not thinking about humility is not thinking less of yourself. Humility is thinking about yourself less instead of,
That's beautiful. That's
see,
beautiful and so important.
it's so important. So yeah, um, meaning, self-conscious about yourself. That's what I mean. So then the last thing is meditation and mindfulness. We hear a lot about the importance of mindfulness. I started 20 years ago when Richie Davison started doing those the brain scans of the Dalai Lama. It was about 1998, and that was at the peak of. No, that wasn't at the peak. Actually, I had gotten better than I used to be, but I was wanting to calm my brain. I didn't know anything about what stress really was, but I knew I needed to calm down in general and just be more, present. So I started following him and following that back in 1998. And then I started meditating around 1999. And it really made a huge difference. That's how I first learned that I was not my thoughts. Like, I'm not my thoughts. You aren't your thoughts.
Exactly. In fact, most of our thoughts are just what we've picked up from media, from others, and we're just regurgitating it.
And we're just regurgitating
That's how we are.
it. They literally get into your field and your brain. And then the brain, it's called autobiography.
This is why I'm so careful with my kids, and I'm always telling my children, what you watch is eventually what you're going to speak. What you listen to in music is eventually is what you're going to be speaking and thinking. Watch good things, listen to good things. Don't watch horror movies, don't listen to songs that have terrible lyrics about raping women, and don't listen to that stuff. Don't watch that stuff, because we are a computer. I mean, Valencia, I think one of the biggest challenges I face is in explaining to people, our brain's a computer.
It is.
And what you feed it is what it churns out.
Absolutely. I've been saying that for at least probably 20 years. And I used to get a lot of pushback about it. Now the metaphor, of course, is caught on, in the masses and everything. But I could see the metaphor 20 years ago, because it's like, number one, later on in neuroscience, they did discover that we have autobiographical memory, which is the story, the narrative of who we think we are. Okay. And with that, that means that we are recording into our cellular memory these thoughts. And repetition actually causes neural connections. And so here's the thing. You can either repetition on, I'm not good enough, something's wrong with me, comparing and judging to others. Oh my God, COVID is going to get me. You can either ruminate on that, or you can tell yourself a different story. My immune system is getting stronger and stronger because I'm getting more and more disciplined. I'm going to take these supplements. I'm going to get in bed. I'm going to turn off that TV. I'm going to stop watching that garbage, whatever it is. And that will become your norm. You have to retrain your brain. So meditation will allow you to, there's different forms of it. This is not a meditation conversation, but there's different forms of it. There's different mindfulness practices. You find one that works for you. It doesn't have to be spiritual. It can be spiritual. But I tell you one thing for sure, as it slows down your brain waves and you can become more in your body, you can feel your feet on the floor, you can feel yourself on the chair, you are helping your physical health as well. It can help your IQ, growing new brain cells. It helps your immune system. Oh my goodness. We have the technology already free, no charge.
Yeah.
We just don't do it. And that's what's going to have to change. Those who are willing to change and go through the little window of discomfort, because it's got to be a new habit formed, those are the ones who will be able to, thrive in the 21st century. We should get beyond surviving now. We need to start thriving.
Age of the Aquarius, time to thrive.
That's right. That's right.
Exactly. So lay out for us your day. How do you incorporate these different techniques? Do you tap every day? Do you meditate every day? How much television do you watch? Like, just walk us through Dr. Valencia Ray's day of no stress, no anxiety.
Sure. So thank goodness I started with the EFT and tapping, like I said, 20 years ago. And now I mostly exist in a state of, equanimity. And through my day, I might be thrown off to either side of the balance, and then I can bring myself back. So let's say something upsetting happening. I'm not saying I never feel any angst about anything, but I feel it. I can feel it in my body. I notice it, and I can acknowledge it. And all you got to do is acknowledge an emotion. The neuroscience shows it only takes 90 seconds to roll out. You don't have to keep cycling it. But I notice what I'm thinking, and I address my thought. And because I'm empowered now around my feelings, I can self-regulate and come back. I can slow down. I can breathe. I can reframe. That's what CBT therapy does. Reframe my meaning. Is it really true that this has to make me upset? What are my other options to think about this situation? If somebody hit me in my car, I could either go, oh my God, or I could say, well, the car can be fixed and I have insurance and that person, thank goodness. Okay. And go on with your day instead of ruminating about it or, et cetera. So I say that to say, once you balance your emotions and get to this place, you rarely have to use EFT or tapping anymore. But let's say I'm doing some inner work in my spiritual practice and I need to use it. I know how to do it and I do. So what I do is, number one, I wake up. First of all, I'm going to start with when I go to bed. I go to bed regularly, sometimes as early as 9:30, sometimes as late. If I'm running late to getting in bed, it's usually between 10:30. 11 11 o'clock is for me now like late. And I really don't like doing that. So I really plan ahead and like stop reading something or whatever, my book or whatever, in time to do my stretches because I need to stretch, before I get in bed. So it's a matter of planning. So you have to plan. And the reason why you want to do it preferably no later than 11 or so, or certainly not past midnight, my goodness, is that you want to start aligning with the circadian rhythm and have enough time that when you're waking up, it's somewhere around 6 or 7 a.m.-ish. When the birds and dawn starts, it can vary with seasons to a degree, but just in general, it's a matter of keeping a consistent circadian rhythm. Remember I referred to that? So I get in bed on time in general, having a goal in that window. And what I have found is I have trained my body in such a way that I will automatically wake up somewhere between 7.5 and 8 hours, because that's the amount of sleep I must need. So if I don't want to oversleep in the morning, I have to get in bed at 10 o'clock is my sweet spot. Then I'll wake up at 5:30 or 6. And so then once I get up, I, believe it or not, and I'm going to just go into detail here a little bit, is that I used to struggle for decades with IBS. And because of all the stress, because of all the, even though my stress level had improved tremendously with all the tapping and all the things I did, I still didn't know about the foods that could be clogging me up and all of this. So once I got in functional medicine and fixed all that, as soon as my eyes are fully open and I'm ready, to get on with my day, my cortisol goes up to a healthy response like it's supposed to do. It's called the cortisol awakening response. My bowel says, time to go to the bathroom. And in TCM, traditional Chinese medicine, the bowel time is between 5 and 7. Okay. So overnight, when I've been cleaning house, morning, get up, boom. And that is so important. If you're having constipation problems, you are holding on to toxins every day. And so you get that clear. Then I go to my quiet room office, and I just, like a lifestyle habit for years now, I'll do meditation. If it's a unusually early morning and I don't have time, I'm still going to do 5 minutes just to, get centered. But usually I take an hour when I'm up early like that. And I'll read, I'll meditate and breathe. And then lately I've been doing more stretching afterwards, and then start my day. You can I shower. I usually, because I intermittent fast now, I usually don't have anything to eat until 10 o'clock. And so I have like a 14-hour window, 14 to 16-hour window, more like 14. For me, 16 is a little too long. But for my stress system, that's a whole conversation in and of itself. But I know that's my sweet spot, 14 hours. And that will actually reduce your inflammation too, because it gives your body a chance to rest and clean up itself, the autophagy. And so there's been a lot of research on that's something good for many people. And then I'll just, do my day. If I feel like I'm too excited, even excitement for some people causes the stress response to go up, because the brain can't tell the difference. It's just, you're just, like this. And so on those kinds of days, I know that I might need a certain supplement to help methylation, and or I'll just do my breathing and make sure, okay, I'm staying present, not jumping out ahead of myself. And then dinner time is usually between 6 and 8. Now, 3 days a week when the gym was open, I was going to a burst training class. I go walking almost every day. I'm probably still going to go walking a little bit after I get off here. And then I do sometimes bicycling. I want to say this to people, is that before I got into functional medicine and started understanding inflammation and changing my body, I had actually lost my muscle tone. I got my muscle tone back. I actually got rid of, some cellulite naturally. I actually went back to my high school weight. And to me, that was shocking.
Amazing.
That was shocking. I had to balance my body. I'm still in utter amazement of what we are capable of. You have to remember, I've been a doctor 35 years. So at the end of the day, it's like to realize after all those years, this has been around for 30 years by itself, but I'm sure in the last few years, it's probably gotten even more refined. Things now that we have the neuroscience gut information, it helps us to target, leaky gut and talk about it more intelligently. Data and all of that's growing. So that's my typical day. I'll always some kind of movement and meditation and breathing and eating my right foods. Finally, I have figured out what foods I work for me better, and a lot of the things we're told can actually not be good for you. It depends on the person.
Incredible. So we have a full plan. A question from the audience: how do you manage your most difficult day?
Yeah, okay.
How do you talk yourself down the ledge, as they say?
Yes, I would do that. Frankly, I would be very conscious of my thoughts if I'm having a bad day, and I've had some bad days. Um, so I'm like, what am I thinking? And that spirituality helps me to contextualize things. I can pull out and see the big picture, and not get caught in the weeds. It's when we're in the weeds and we're worried about it, that we get into fear instead of faith. So I created an acronym 12 years ago, 13 years ago, fear, but I had my personal acronym. I didn't have the one that everybody talks about. My acronym was based on neuroscience, and it was fictitious evidence affecting reality. And fictitious meaning a story. You know, fiction is story. It's not nonfiction, it's fiction. So fictitious evidence affecting reality is if we look for the evidence of what's wrong and keep focusing on it, keep telling ourselves that story that day, woe is me, I'm a victim, I can't do anything, I'm helpless, oh my God, it's gonna be worse. Instead of doing that, what I do on those bad days or whatever, I catch myself. And I'm like, well, this is done. What can I do? Ask questions. Don't already think you know. Ask the universe questions and you'll start getting insight. Like, okay, what can I learn from this? How can I do this differently? How can, so there's that cognitive piece that really matters because it can set off a chain of emotions, right? But then there's also like, so the sooner you get refocused, the sooner you get more embodied, the sooner you connect with your breath, the more soon you can get back on track to think of plan B or to reverse what you can reverse. Because some things you just can't reverse. You know, if it's messed up, it's messed up. You got to start over or whatever it is. And to have some joy and laughter and humor about it. I'm still working. That's my growth edge to continue to develop playfulness and not be so serious because you can imagine, I used to be a cornea transplant surgeon. I literally did
Wow.
cornea transplants on people.
Wow.
And you have zero room for error. So I was intense for a reason. But later, in the last several years before I sold my ophthalmology practice, I became known as the doctor with the meditation music in the OR because I was already learning, and that was back in 2000, oh God, 2 and 3 and 4, that quiet music, that relaxing music, patients used to love it. They were like, I like your music, Dr. Ray. It would keep me focused and calm. And, I was changing my brain. I didn't know it at the time because we had not discovered neuroplasticity yet, but I was following the meditation, right? And visualization helped a lot too. I would imagine this before I got in the OR. And it really, really, really made a difference. I stopped being so tense going into the OR because I was so wanting that patient to have a perfect outcome. I actually became an even better surgeon when I learned how to stop the tension because the tension, fear, it combobbles your brain. You're going to be nervous. Well, you want your surgeon hands looking like that?
Yeah, exactly.
Wow.
Wow, this has been so insightful, Dr. Valencia. I want to thank you so much for taking so much of your time out of this very, very busy, crisis-filled time and for sharing very easy, very doable things that we can all embark upon to make sure that we retain our sanity through this crisis. Thank you so much again. Give everyone information. If someone wants to reach you, now you are practicing telemedicine and you are still doing tests and things like that. And if someone wants to take charge of their health because, hey, we have time now, what can they do? How can they reach you?
Yeah, so if you see my name there, Valencia Ray, MD, you probably won't find another one on the internet. So anyway, you
That's a
put
beautiful name.
that whole name in there. It'll take you right to my website. My website is valenciaray.com, without the MD. It's just, or either the MD will still circulate you there. But that's the main website. And then there's free resources you can learn on the website and PDFs and, some video things. And I'm going to be increasing that. You can contact me on any page says set up your free discovery session, and you can watch a little video before you schedule that. The discovery session can be done, of course, by Zoom, telephone, and historically, we normally do it in person. But right now, just do the Zoom, and that for telehealth for me. When I left ophthalmology, I became very skillful at technology, unlike most doctors. So I've been using Zoom since it was virtually created
Nice.
years ago. And for me, telehealth, I've been doing it for the last year, well, ever since I started functional medicine. And I have a practice in my office is in Walnut Creek downtown, but because traffic in California is so busy, or I do telehealth from Illinois because I have a license there too. Telehealth for me was like, okay, I can do that because I'm already doing it anyway. So yeah, we can do that. And tests are drop shipped to your house, or if we need certain blood tests, there's a boutique blood draw lab. You can have your blood tests drawn by the one phlebotomist who's in there. And you have to look at it this way. This is COVID related, meaning if you do this right now,
Yeah.
you are probably better off than if you went to the regular system
Yeah.
to do some kind of checkup for your blood draw or whatever. No, it's not truly an emergency visit per se, but if you can start to reduce your inflammation and make yourself healthier, maybe that'll keep you from ending up in the ER in the first place, right?
Or on a ventilator. Yeah.
Or on a ventilator. If you know these things I'm talking about, then let's face it, 70% of Americans have some type of chronic disease. Diabetes is 1 in 2
Yeah.
people now coming up. There's already a lot of risk factors out there. The sooner you start, and you can even see from my testimonials on my website reviews, people are saying, wow, it's only been a few weeks, and I'm like amazed.
Yeah.
So it's dramatic. It can be dramatic if you do your part. It can be dramatic.
Wonderful. Thank you so much again. Big hugs. And for the rest of you, this is
Big
the
hug.
remarkable opportunity for you to implement all the beautiful things that Dr. Ray has shared today. Don't spend your time lying around in bed watching Trump and news. That is not a great way. Get out of bed, go for a walk, deep breathe, tap, and be more productive. Spend more beautiful time with your family and your loved ones. And join us at healcircles.org. We are here. We're awaiting you to join us so we can continue the conversation. Thank you so much. And I'll see you on the next live stream. Thank you.
You're welcome.